Precious. Now I'm back for my Eladerm update. 3 weeks ago, I undergo Eladerm for my face, for my blemishes, dark spots, and acne treatment. Now, this is the update for after 3 weeks. So, nakita nyo naman po, may improvement. So, mag-undergo ako for another session para po magtuloy-tuloy yung update for my skin po. Don't forget to click and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Today is another precious day as we have a follow-up for Miss Precious. Welcome back.
Hi, Doc.
Yeah. So, before we had this condition of cystic acne, and Precious right now has this flat lesions already. So, we were able to kind of zap all those cystic acne last time when we did the procedure so-called Eladerm. So how are you now, Precious?
Much better po.
Yeah. She's
Nag-gain po ako ng confidence.
yes, she's a lot happier now. Although the last time, because we were sharing, of course, when you have all this, acne lesions, so the so-called acne vulgaris to the moderate type, we kind of like, feel a bit down, right? Yeah. So right now we're seeing improvement and we're glad we're able to help Precious with that kind of condition. So, ayan na naman si Precious. Very, yeah, happy. Positive vibes lang. Okay. So, for now, we're doing another session of the Eladerm just to continue with our management because these kinds of procedures, they're done in sessions, in intervals of, it could be like 3 weeks, 4 weeks, depending on also the healing of the skin, the condition of the skin, and it's like based on the patient's skin condition, okay? Now, assessing also Miss Precious yan. And somehow we wanted also to improve the profile, okay? And further enhance her confidence and somehow enhance the looks, okay? And I was recommending to Precious here, let's improve the profile of the nose, okay? So we Asians, okay, we have this in our genes, this anatomy of the nose, okay? So I'm an Asian, I'm a Filipina, and I had a flat nose, I had this downturned tip, round tip, wide tip, okay? I also had a treatment done on the bridge part, which is a non-surgical one, okay? And I want to share it with Precious, right? Why not? It's non-surgical, so it's not really gonna change the look or the face of Miss Precious here because she only wanted something natural, something subtle, right? And still her, still very recognizable. So we'll do a procedure Eladerm as well as a nose enhancement. We'll show you when CSA Medical Aesthetics returns. And we're back, so we're doing another session of Eladerm for Miss Precious here. And the indication for our Eladerm is the acne as well as the acne marks, blemishes, acne scars. Okay, we'll start on the upper third, the forehead region. Okay, so again, I have my tip here. So this is the one that we're gonna work on, starting with this. Okay. Okay, we're now on our second pass. So for the second pass, we need to just target those problem areas. So like for example, those with acne marks, acne blemishes, acne scars, we can just do the second pass on those problem areas. And then we'll also target the nose again. So you can use this for also for those large pores, okay, for those fine lines, wrinkles, saggy skin, loose skin. So we want to restore good quality of skin plus good skin elasticity, tightness, firmness, full face rejuvenation for our Eladerm. And last on the chin. And then after this, we'll be proceeding to the nose enhancement. So we'll be enhancing the nose of Precious, and we will be using so-called the non-surgical nose thread lift for Precious right now. Okay, so for this part, we want to sterilize everything. Okay, so her skin is a bit numb, and we'll be using our local anesthesia as well. And we want to improve the dorsum height. We also want to improve the nasolabial angle there and somehow narrow the ulnar width. We want to follow the so-called intercanthal width. Okay, so looking at this part, the nasofrontal angle, we want the angle to be within that 115 to 130 degrees. Okay, and we want only a natural result for Miss Precious here. I'm gonna be numbing the area, so disinfect please. So this is my local anesthesia. I have a lidocaine 2%. Okay, lidocaine here, and then injecting into this part here and this. And Precious has high tolerance. Okay, so some lidocaine only here for the bridge augmentation, bridge elevation or enhancement. So the entry point. Okay. So since Precious has a skin that's hypervascularized, okay, so she tends to have redness. So it's expected some pinpoint bleed there, okay. And then we'll make a tiny entry point, okay. So I'll just be using PDO threads and then glide this one here. So we have the nasal tip. It has thick fatty tissues. We'll also combine with the so-called fat dissolve or our lipolytic solution later on. Okay, we'll just use a few of our PDO threads for Precious here. Then we'll insert another one. Okay. So this is a non-surgical technique. Okay. So that you can do this immediately after your Eladerm. Okay. Actually, I'm noticing on the dorsum also there was like a pox scar here. So somehow we wanted also to improve the texture of the skin. So PDO threads are also known for the collagen stimulation, so they will also have a skin regeneration effect. So we're still inserting up to the bridge top, the radix part. So we're almost done here. So usually when we have some acne scarrings, we expect the so-called those fibrotic bands from the acne scars, and then we'll do the tip elevation. So we'll also use this entry point. You can make another entry point depending on the length of the columella there. So I'll numb the base of the columella. So this part here, inhale, exhale, Precious face. So just a numbing into the base of the columella there and infusing your lidocaine here. So I'll be using some short threads for this part here. Okay. And this is a columellar space here. I'll pinch. Okay, this is just to project the nasal tip. We want a better tip projection. We want that so-called nasolabial angle, which is for women, we want that 105 degrees. Okay. And there you go. So we can also combine with the so-called mesotherapy and Allertox. Okay. So we're done with the non-surgical nose thread lift. We'll show the result to Miss Precious when CSA Medical Aesthetics returns. And we're back, so let's show the result to Miss Precious. Precious, here's a mirror for you to check the outcome of what we have done. So the nose enhancement and also the post-Eladerm treatment. Of course, with the Eladerm, you will expect some redness and also some, some parts that has kind of a tiny elevation from those micro pins, okay? But in a little while, it's gonna flatten and the redness will also go away in a little while. Because with Precious here, because her skin is kind of associated also with a condition called rosacea, so she's really prone to redness, okay? Now, we also did the nose enhancement, and on a side view, I'm checking on the nasofrontal angle. It's a lot better, plus the nasolabial angle, it's a lot better. It's projected. And later on, we'll still do the so-called mesotherapy for the nose, plus our tufts to kind of narrow the sides of the nose, plus also reduce the size of the nasal tip to reduce some of those fatty tissues, okay? Because we have those thick fat tissue on our nose tip, okay?
Much yung nose ko, mas
Yeah,
prominent na
it
siya.
has,
Parang it looks natural po.
Exactly, right.
Still, hindi, nakikilala ko pa rin yung sarili ko.
Exactly. So some people are worried that they're going to change their looks, their face. So this kind of procedure is really indicated for those individuals who are not into the rhinoplasty surgery, but they only want a natural enhancement, something that, it will improve the profile of the nose, but still, they're very recognizable. There you go. So with the Eladerm thing, we're also happy with this device because we're able to do those micro needling whereby patients are comfortable, okay? Because in the past, we have patients who don't want to repeat micro needling because of the pain. But thanks to Eladerm, it was able to incorporate the pain reduction, making use of the cryo gas spray, the cryogenic cold spray, and it's able to lower the temperature of the epidermal layer to about 4 degrees Celsius, okay? There's also another device. They have the cooling plate, but it's only like a temperature 23 to 24 degrees Celsius. But this one is really able to make that temperature really lower and making the procedure really a lot comfortable for our patients, okay? Plus, of course, the one that we want to achieve with that one is to improve acne scars, plus also those large pores. We want to kind of tighten them. So we can achieve with this device, the Eladerm. This is the painless microneedling with radiofrequency. I think this is the only device all over the world with this kind of cryogenic spray, the microneedling RF. Plus, it has those what we call like pulsing mode. So they have also the so-called pulse durations, okay? So they subdivided like those pulse waves into like four waves. Yon, okay? So additional benefit from this device, plus the tip, it has also the vacuuming. So when it's suctioning the area of treatment, it's like the entire skin will be even, okay? Really flat and able to pull it up like that, and your micro needles can really go into the exact target layer. Yan. If you want to target the dermis layer where you have your fibroblast, you can really target that directly, because there are other devices when you place the tip on the skin, kind of like there's a denting of the skin. Yung parang napupush pababa yung skin. So when you like make those needles insert or go down, so the tip will just be in it could be epidermal layer. So that is unsafe. You might burn the epidermis. So we don't want side effects of burning. We don't want side effects of blisters and any other adverse effects, even post-inflammatory hyperpigmentation. So with this device, we can prevent those side effects from microneedling with RF. Okay, so the tip has the vacuuming. The tip has this emission of your cryogas spray, plus the needles The needles are really made really so sharp, okay? And because if you have a blunt tip, right, and inserting it, it's gonna be very painful. Plus, you might not be able to achieve the kind of result you want to achieve, right? So the sharpness of the tip, the needles, so it comes in like total of 25 micropins. Actually, they're also coming out with 49 pins where we can use this device for areas in our bodies, like loose areas, stretch marks, what else? Hyperhidrosis also, and scars in other parts of our body, scars sa arms, scars over lower extremities, okay? So it has other indications apart from like working on the face as well as the neck. We can also work on the neck part, like those with neck wrinkles. There you go. Plus, I love it because it has dual frequency. We have 1 megahertz and 2 megahertz, okay? So, multiple benefits from our Eladerm device. For those who are doing microneedling with radio frequency, but they're afraid because they're too painful. So, this is now the remedy. The Eladerm has the pain reduction technology in the form of the cryogas. Okay. So, any message or sharing to our televiewers?
If you want to have a good skin and you have a problem like me, you can go to a CSA with the Contessa. As you've seen from my previous skin condition, it's a lot better now. Exactly. And I'm looking forward for a better skin in the future.
Yeah, that is our goal for Precious actually. Somehow, we want to really improve her skin quality. Like, how many percent do you think is the improvement from the previous treatment we did? Like this one? Ilang percent?
A lot better. Like, hindi man 50%. Before, it's a lot of blemishes. Maybe at least 70%.
That's a big percentage.
And in a short period of time.
Exactly.
Before the blemishes, it's hard to alisin yung mga blemishes.
Yeah. So the blemishes were like staying longer, not so easy to remove. But with this Eladerm, it really gave a big improvement already. Plus, you mentioned to me a while ago, the texture, you were saying it was rough. But before, now,
when I wash my face, it was rough. Then now,
ang
sarap maghilamos kasi
it's smoother, less of those cystic or nodular acne. Because when you were doing your facial cleansing every night, you wash like that, you can feel all the nodules or all the cystic acne, right? It was bumpy and rough.
Kind of depressing.
Yeah. So now, when you wash it, it's flat.
Yes po.
And
I'm enjoying my skincare now, like
exactly.
So,
and there you go. That's our goal, to achieve the 100% improvement, okay, with our Eladerm treatment plus your skincare. So for those who have questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please watch the previous episode of Precious. You can check the original condition of her skin. Yan. Thank you so much, Precious.
Thank you.
Okay.
Thank you so
And
much.
thanks to all our televiewers for also subscribing and always watching our videos. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.